Forced to work from home by your employer? Laid off or feeling depressed at home? Do you want to make money working from anywhere? We'll show you how to do it from your couch. It's time for another episode of the Work From Home Show. Coming to you from their homes in Austin, Texas and Tampa, Florida, here are your hosts, Adam and Naresh.
Welcome to another episode of the Work From Home Show. This is your host, Adam Schrader, here with my co-host, Naresh Vissa, and we are once again joined by Dr. Sujay Shate. We're talking today about the coronavirus, Covid-19. Last time we talked about how we can work from home as a medical professional. Today we're going to be talking about how long society is going to be working from home.
So before we started recording, you said it's been craziness going on. So tell us about that craziness, what you've seen from your group, the University of Chicago hospital that you visit once in a while and work at once in a while, kind of what's going on?
So interestingly enough, right now, volumes are down. They're way down because of all the social distancing restrictions and people not going for any elective work. So at the University of Chicago, there's only one radiologist in our breast section now working each day. So because they've canceled all their screening, mammography, anything elective that doesn't have to be done. And so our group also here, like during the day shifts, they've moved them from 8 hours to 6 hours because a lot of the outpatient volume has just dropped off a cliff. So there's just a lot less work right now. But I think that what to keep in mind is that with the pandemic as a whole, and I've done some reading about it in my time off as well, is that there will be more of a peak as more people are diagnosed and needing to come into the hospital for treatment specifically of coronavirus. And even that might be a month down the road, but we're definitely bracing for like not an assault on the system, but like a higher volume of patients with respiratory and chest symptoms. And so we're not seeing that just yet, but I think that over the next couple of weeks that will increase. And I'll just use this as a chance to put this out there too to all the viewers. I think it's critically important to social distance and follow all of the guidelines that are being put out by the various governors and various public health authorities, the federal government to a degree. Because in terms of the healthcare system, if there's two ways to look at this. If we really just pull the Band-Aid off and everybody gets this, or not everybody, but a lot of people get it and then recover, we'll be done with it faster. But that's not sustainable for our system, and there will be a lot more deaths that are needless. And I think that the way that we're mitigating this by distancing, it does make it it does drag things out over like multiple peaks and troughs. And like, you might get a new wave of infections, but these waves are much more manageable for our healthcare system, at least while we wait for an effective vaccine. And so I think it's important to keep in mind that even though that does drag things out a bit, I think for the greater good and to make sure that we're not overwhelming our healthcare system and putting our healthcare workers at risk, that we have to really be mindful of some of the social distancing efforts to really help to dissipate the virus in the community and to minimize community spread as we move forward.
Well, the precautions, this is unprecedented. As you know, New York you're from New York, and the entire state, not just Manhattan or Long Island, the entire state is on lockdown. And to me, I'm not a healthcare professional. I'm a business guy, kind of an economist too. And from that perspective, I'm still just trying to wrap my head around everything because the economy has come to a halt, a sudden halt. And tens of millions of people have lost their jobs almost overnight. And so my question to you as a physician, and you have all these contacts within the industry, some of the best contacts in the world at the University of Chicago and in Chicago in general, if the government did not, the states, the local cities, if they didn't enact kind of these guidelines, the CDC, and people just went about doing their everyday lives, would this have gotten as bad as the predictions have shown? I mean, they were showing like 1.3, 1.4 million people dying because of this virus. Right now, as of this recording, there are less than 300. But would it have gotten that bad?
Like you said, it's uncharted territory, and I think that the potential of that happening was very real. And I think that some of the measures we've taken, and even Illinois, for example, we're all in lockdown as well, starting today at 5 o'clock. So just like New York State, Governor Pritzker here has issued a lockdown. And I think that these measures will go a long way in mitigating that number. But I do want to caution people that right now we're at 300, but this is exponential growth. And not as a way to alarm people, but it's just, we've already seen it over the last week or two. Like, we had 100 cases in the first month, and then we went to like 1,000 in 5 days. So you just see how it goes. And I think that knowing that, we have to be ready for a spike and try to minimize it as much as we can. And the way to look at it, and I think that if you follow the news, and I think Dr. Anthony Fauci and some of the authorities on infectious disease will say, and I totally agree with, if you think we're overreacting now, that's good, because that's what we should be doing in order to be successful down the road. So you want to feel like you're overreacting to make sure you're doing the right thing. Otherwise, you're underreacting. That's kind of the thing to keep in mind.
So for our listeners out there, when can they, in your opinion, I've heard some things saying, even July or August, when do you think we'll kind of return to some form of normalcy in our society?
So I think that the infectious disease authorities are kind of saying that what they're seeing happening if we do the social distancing is kind of different waves of this coronavirus, where we have like the current peak, or we're heading toward a peak, and then it abates for a while, and then there's another peak until there's like a vaccine or some solution. And that could mean that, those waves could come every few months. But I think that, at least speaking for the current state that we're in, I think that a reasonable guess would be that not a couple of weeks. I think that for at least another month or two, we're going to have to see what happens, because this is not going to end next week. And I think that people should be ready to hunker down for at least the next several weeks to month, maybe 2 months, and then see where things are. Because at that point, we might abate a little bit in the summer, depending on how well we socially distance and mitigate the virus. But then, it could happen again in the fall, that there could be a resurgence if it's not kept under control. So that's kind of how I look at it. I don't look at it as we're going to have 18 months of this straight. I'm not necessarily saying that. I think that there's definitely going to be a couple of months that people should be prepared for, and then we'll just have to see from there how the numbers are looking in terms of how well we have this under control. And like, this is, I'm generally, the way I like to look at things is as optimistically as I can. Now, we've never been in this sort of territory. We might come out with some effective treatments or things down the road that change the whole course of it. So I would stay tuned for that, but I think people need to be prepared to hunker down and be disciplined about socially distancing for at least the next month or two.
As a radiologist, diagnostic radiologist, have you gotten a chance, maybe not on a live patient, but just kind of educationally, or it's been shared with you within your medical group, have you gotten a chance to look at an image of what this Wuhan virus is doing to the system? Can you kind of explain the science behind it? Because I think people don't really understand what's going on. They think it's like a fever that's going to come in and then it leaves. So can you explain medically what's actually happening?
Sure. So the Wuhan virus is a coronavirus, and when they call it a coronavirus, that's actually a class of viruses, and the common cold is also a coronavirus. So it's not the most specific name. I guess COVID-19 is specific for this virus, but common cold is a coronavirus. The SARS virus, if you remember from 2003, which was it was actually higher fatality rate, which also made it easier to contain, ironically enough. But that was a coronavirus closely related to this one. And so these group of viruses are respiratory tract viruses. And what they do is they'll invade and multiply in the upper or lower respiratory tract. When I talk about upper respiratory tract, that's sneezing, coughing, sore throat, those sort of symptoms like you get with a cold. Lower respiratory tract things include shortness of breath, pneumonia, sputum production. So that's kind of there's a lot of variety of symptoms that this virus can cause depending on the person. Some people even have GI symptoms, but it really is more of a respiratory virus. And what I'll say, it's definitely, and I know they talk about mild to moderate cases for young people especially, but this is not a common cold. It's definitely going to be more severe than that, even if you have a mild case. So that's kind of one way to look at it. It's about 2 weeks is what they say for people to kind of fully recover if they do contract it. And the thing with this one is, even on a CT scan, I've had a couple over the last couple days where I've had suspected COVID-19 infection, and it looks just like a pneumonia with different imaging features that are similar to even bacterial infections, but it's not always that different in appearance. It's just that with patients who are exposed or have had a travel history and you see it, that would predispose you to think that maybe they do actually have it, but the symptoms are going to be very similar to other respiratory viruses. Again, not the same severity, but there's a spectrum. So some of the different ones like SARS and MERS that came out in other years were more severe, but this one is easier to pass along. So there's pros and cons.
And I'm glad that you made the clarification, because even in my reading, just generally calling it the coronavirus is not accurate. It's not very specific. And I went to journalism school undergrad, and a lot of the reporting that's being done, just calling it the generic coronavirus, it's somewhat misleading, which is why on this show I call it the Wuhan virus, because it's more specific.
Right.
COVID-19, the issue I have with that, I don't know, I'm sure you might run into this with other diseases or viruses that you look at, but the problem I have with COVID-19 is there's apparently a COVID-18 and there'll probably be a COVID-20. In fact, I'm positive there's going to be a COVID-20. And so with all the number system, it becomes very confusing. So I think it's good to kind of distinguish, because this is going in the history books. COVID-19 will go in the history books.
Exactly.
But again, just being more specific, I think it's important for doctors, especially doctors, but doctors and news media, everyday people, to get educated on what this is, what the different type, you said the common cold is a type of coronavirus, as well as SARS and MERS. Get educated on this stuff. And that's why I wanted to bring you on the show, so that you could help clear this up. Absolutely.
No, and it's important to distinguish, because I think there's a lot of confusion surrounding it and people wondering what it is. And it really is it's a respiratory virus, and there's a spectrum of severity from MERS, SARS to corona to the cold. And there's several other ones in the family, but that's where it fits into the spectrum. And I think there's a lot of misinformation or a lot of assumption going around that it's good to clear up.
Awesome, Sujay. Well, thanks so much for coming on our podcast. It's been just truly, it's been a lot of fun. It's been a delight. We've learned a lot from you. And so for those listening, visit our website, www.workfromhomeshow.com. That's workfromhomeshow.com. You'll be able to find out more information about Dr. Sujay Shate there at his episode page. Get on our mailing list. If you get on our mailing list, you'll get a free copy of my book, 50 Shades of Marketing. And that book's going to be coming within the next 3 weeks. So we're going to send out a special link to all of our email subscribers. We're now on all the podcasting platforms, Apple Podcasts, Google Podcasts, iTunes, TuneIn, Stitcher, SoundCloud, you name it. We're everywhere. We're growing. We've gone from what, Adam? We had 10 listeners last week, and now we're up to 12. Is that what it is?
Oh, we're up to like 18.
Exponential growth.
Exponential growth. There you go.
So thanks a lot for reaching out. And in fact, the traffic has been so good that we're starting to get emails. So you have any questions? If you want to reach out to Dr. Sujay Shate, I'll give them a chance. Sujay, how can people reach you?
Probably the easiest way will be through email.
So what we'll do, reach out to our general email, hello@workfromhomeshow.com. That's hello@workfromhomeshow.com. If you have any questions for Dr. Shate about working from home, medical professional, maybe you're in college right now and you want to go to med school, you want to become a doctor, whatever it is, feel free to reach out. We have listeners of all ages, men, women, transgender, gay, straight, you name it.
Absolutely. Anybody, any questions are welcome. So
yeah, it's amazing how 18 listeners can encompass so much, Adam, right?
It is. Hey, everybody needs help in this time.
Yes, everyone does. So for Adam, for Dr. Shate, I'm Naresh Vissa. Thanks for tuning in to our show. And until next time, keep on working from home.